Hello, everyone. Welcome to this virtual field talk. My name is Sharon Bowen. I'm one of the education managers at the Maryland Zoo. We would like to start off by thanking SCNH Group for their sponsorship of this virtual field talk series. Their sponsorship is making it possible for us to open this experience to everyone who wishes to attend. So we're really grateful for that. Before I welcome our guest speaker, just a few housekeeping items. We're going to be here for about 50 to 60 minutes. My colleagues who are behind the scenes running the technology will be reaching out throughout the talk in the chat feature, so with some additional information. You're also welcome to use the chat feature if you need technical assistance. Your video and microphone will remain off, but we do encourage you to ask questions through the Q&A feature, and we will have time after our speaker's presentation for Q&A. And just a quick heads up to everyone that the presentation does contain some images of birds with injuries and of surgical procedures, so just something to be aware of. All right, well, today we are so pleased to highlight the work of one of our most important conservation partners, the Southern African Foundation for the Conservation of Coastal Birds, or SANCCOB. And I'm delighted to introduce veterinarian Dr. David Roberts. Dr. Roberts received multiple degrees from the University of Pretoria, earning Bachelor of Science and Bachelor of Veterinary Science, and a Master of Science in Veterinary Science. He has been clinical veterinarian with SANCCOB since 2017. He'll be talking to us today about the kinds of work that SANCCOB does, and we'll share some examples of cases that he's worked on. So I'll now turn things over to our speaker, Dr. Roberts. Thank you so much for joining us today. He is muted.
Hi, everyone. Thanks for the introduction. It's really great to be here and to be able to chat to you about some of the work we do at SANCCOB. So I'm going to share my screen and go straight into my presentation. So SANCCOB is, as you've heard, the Southern African Foundation for the Conservation of Coastal Birds. And we're a non-profit organization. We're based in South Africa, in Cape Town. And yeah, I work full-time there, and I'm a seabird vet. So I work a lot with penguins and then with other seabirds as well. So here's some information on the organization. And yeah, SANCCOB stands for the Southern African Foundation for the Conservation of Coastal Birds. And really our mission is to protect seabirds, to reverse the decline of seabird population through rescue and rehabilitation, and the release of ill, injured, abandoned oil seabirds. But we don't only do oiled wildlife response or rehabilitation. Those are our biggest, what we're most well known for, but we also branch out into real conservation in the wild. So we've got several projects working with conservation authorities and people looking after seabird colonies in the wild, and advocacy to try and reduce those pressures on our ocean ecosystem, and especially the birds, to try and make sure that there are good populations, healthy populations in the wild. And to do that, we also assist a lot with applied research. We run our own research projects, and we help with students who are looking at seabirds, and as well as a bit of training and education, and that's everything from our interns, from seabird scientists that might be going to places like Antarctica or the islands between South Africa and Antarctica, to people working with birds in South Africa or rehabilitation centers, our own interns and volunteers as well. And of course, our environmental education program, so working with everyone from local South African families, school children, and anyone else who wants to learn more about seabirds, especially the penguins and their plight. So this is where we're based. So this is the southern tip of Africa, and I'm here. My base is in Cape Town, in Table View, and we also have another facility in Port Elizabeth in the Eastern Cape. And these centers are close to the biggest seabird colonies in Southern Africa. So there are a few islands along the Namibian coast and then down the west coast of South Africa, but the biggest seabird colonies, especially the penguin and gallant colonies, are near Port Elizabeth, where the center is. So just, yeah, there's our beautiful building in the nature reserve in Port Elizabeth, and our Table View Center with its beautiful view of Table Mountain. Here's some of the facilities at our Table View facility. This is our seabird hospital. It was built in 2018. and it's really great state-of-the-art place to have privilege to work. So as here is the admissions room where we do most of our veterinary work, and then going down there we've got a specialized kitchen for preparing food. Some of our other facilities are a wash bay and laundry. So looking in here, this is just off the admissions room. This is a little veterinary lab and my office where we can do x-rays. So we've got a digital x-ray machine, microscope. I spend a lot of my time looking at blood smears. Here's a bunch of about 100 blood smears that I have to look at. Sometimes we have over 200 patients at a time, sometimes even more, and often all of them have to be led every week just to check for signs of disease, anything else we might need to address. This is the surgical theatre where I do most of my work. Most of our patients are penguins or other seabirds that have wounds, and so we clean the wounds and dress them in here. And then we also have a sterile theatre. This is where we do our most intensive veterinary surgeries, pinning broken bones and procedures like that. You need proper sterile facilities to do. Here's some of our outdoor facilities, also recently built with the new Seabird Hospital. So this is our one of two pen pools that we have, and then we also have an aviary pool over here. And these are excellent for swimming most of the birds that we have. All of these pens can house penguins or other seabirds. And so, for example, at the moment there's a pelican swimming here, there are a few penguins in the background. And here the penguins using the pool. All these gates open and close, and we can let penguins or other birds from each pen in individually. They can have their swim, and that's very important for making sure they have natural behavior, as well as making sure that they're fit enough for release and they're waterproof enough for release before they go out. This is our food prep kitchen, very important part of operations at SANCCOB, because all our birds need good quality food, and here's just a small selection of volunteers that are preparing food for, this is actually recently for our Cormorant response. But very nice area to work in, and we have a walk-in fridge and freezer, so we can keep the fish, mainly feeding fish to our animals, nice and clean and cold, and allowed to defrost safely. We also have a dedicated wash bay. This is for oiled wildlife response, and this is just one corner of it. I'm showing some of the equipment we've used after washing one bird, but of course it's set up with basins for washing, other ones for rinsing, and a specialized drying area, so we can bring through large numbers of birds if there's a big oil spill and wash them, dry them, and then move them outside as soon as they're ready. SANCCOB relies on volunteers for lots of our work. We have a small core unit of 36 staff members. Some of those are based at each of our facilities, and we have penguin rangers as well. Penguin rangers are out in the colonies looking after the penguins and reporting anything to us, working on the conservation and bringing any sick or injured birds that may need our assistance. We have interns, and they stay from between 3 to 12 months and really get hands-on experience on how to work with the birds and a lot of training, and we rely on them eventually when they're well trained to help us in all the areas at SANCCOB. I also host some community service vets. These are newly graduated vets who need to work for the state, for the country for 1 year after they've graduated, and some of them work at SANCCOB either full-time or part of their time. And then in a year we can see about 100 local and international volunteers. Sometimes there's a lot more depending on what we need. Those are people from all walks of life, over 18 years old, who come in and work with SANCCOB, and they go around for about 6 weeks each. And we really welcome anyone who wants to be a volunteer to come and get that experience working with penguins, with our other birds, and the long-term interns also work in the ICU and with some of the medicine as well. So here's some of the veterinary rehabilitation work we do. So for example, here's a heartflop gull. It's one of our smaller seagulls. He's having an operation on his leg. Penguin with a wound over here that's getting treated. And this is a giant petrel, a large bird similar to an albatross that we did x-rays on. We actually did a barium study, so that's looking at putting something that you can see shows up well on the x-ray into the digestive tract. We were looking to see if there was anything stuck in the stomach. There's the stomach. It's all quite full of the white fluid, and the intestines afterwards, showing that everything's passing through. It's nice and healthy. We see about 2,000 birds in a year. Of course, that changes depending on the year and depending on what we're dealing with. But about half of those are African penguins and half are the seabirds. And here, just a few of the cases that I had the privilege of working with. Some of the interesting ones, some of the really good recoveries as well. Always nice to show how tough some of our patients are and what they can go through and to survive. This is AP037. Each of our penguins gets a number, and we start at 1 every year. So this 37th penguin from last year came in with a rather nasty wound, really smelly. And then after several procedures, that was cleaned up, but there was a big patch of missing skin, and that took repeated surgical procedures to pull that skin closed and treat the wound and make sure it wasn't too painful or infected. Slowly getting better over there. You can see it's juvenile penguin, not the black and white, bright black and white colors yet. This is one of our community service vets who was working at SANCCOB last year, and this was really her patient. So he received most of the procedures, and gosh, he did a really good job just slowly closing that wound. So that still, while it was quite fresh, and here pulling closed with quite a large scar there, and then sutures coming out and a much smaller scar. Still missing a lot of feathers over there. Usually with penguins, we don't shave them when we do surgery, and that's because they have a layer of waterproof feathers over their down. The waterproof feathers are like an anorak, and the down's like a jersey, and you want to be able to keep the down dry. And as soon as you take these feathers away and the down gets wet, they can't be released like this because they'd get too cold. And so any bird that is missing feathers needs to wait until he grows his waterproof feathers over the top. And that usually only happens once a year when they go through their molt. In South Africa, that happens in December or November, in the middle of our summer. Luckily, shortly after his surgical procedures and after the wound had healed, he went into molt. They get really fat. Naturally, they wouldn't be able to catch fish at this time, so they put on a lot of weight, and then they come to shore. And they lose those feathers, and these are the ones that are growing out underneath. And here, about a week later, showing the really nice, pretty adult black and white feathers, and a few of the juvenile feathers still sticking around, falling out. So we keep them in our home pen while that's happening. And then afterwards, he looks really handsome. He's got these beautiful black and white feathers, really nice and shiny. And this is just his last veterinary inspection before release, having a look at the wound, making sure there's nothing wrong there. And shortly after that, he, as soon as he was waterproof enough and fit enough, he was released into the wild. So we don't only look at after penguins. Sometimes we get a whole host of different species, and sometimes we're lucky enough to look after an albatross. This is an Indian yellow-nosed albatross, really beautiful bird. And this individual came in underweight, a little bit blown off course, so they don't often spend time in South Africa. But so he just needed a bit of time to rehabilitate, and he had some wounds on the bottom of his feet as well because he hadn't been flying properly. The problem with these wounds is they're a bit like bed sores. They're caused by pressure on the feet and blood supply not getting to the delicate skin. And many pelagic birds, those that spend most of their time flying or in the deep sea, aren't good at standing on solid surfaces. And so you have to really take care of their feet, otherwise these sores get worse and worse as they're in rehab. So this is just putting some ointment on and putting some bandages on. We had a really great collaboration with a vet who was visiting from Brazil, who showed us how they look after similar species. They actually also have yellow-nosed albatrosses there. And so working together, we developed this nice little method of putting a nice soft pad on the bottom of the feet and bandaging them up. So those are the wounds. And this is how you hold an albatross for bandaging, somebody controlling the head. And I can stand at the back over there with bandages on his feet. And there's a green-footed albatross, looking very proud of his bandages. And those would stay on at night while he's standing, not able to go in the water. Nice soft bedding as well, just to reduce those wounds, and then swimming most of the day. And because of those, the foot wounds didn't get too bad. He could be successfully released as soon as he was fat enough. You really want them to have good body condition before you set them out in the wild. This is a juvenile Cape gannet. Gannets are an endangered species, a bit like the boobies that you see in other parts of the world. And usually they're these really striking white birds with beautiful black facial markings, but as juveniles they're dark black and grey. And we had a few with broken bones. This is a case from about 2019 when he had some broken wings, and that's just undergoing a surgical procedure to put some steel pins into the wings to allow them to stabilize so they can heal. So this was one individual. Here's the broken bone over there. We put these pins inside, and then you can see it stabilizing, and then shortly afterwards, healed really nicely, almost normal. A little bit of a callus over there. He could fly quite nicely afterwards. And here's another individual. There's the break. This is an elbow bone, stabilizing pins, holding it closed, and this is after it healed. And when they can fly like this, so this is just practicing the movement, watching how the wings flap symmetrically. They're not drooping, they're not moving in a funny direction or anything like that. We know that he's good enough for release. Oh, that's the same video again. Yeah, here's an interesting patient that we had recently, an African penguin again. And on x-ray we found he had this bright white something inside him. And that's in the area of the stomach, so the stomach's over there. So he must have swallowed something, and probably metallic. We couldn't get it out by getting him to regurgitate it, so we had to use an endoscope. And we had great support from the endoscopy company who jumped at the chance to help the penguin. So this is just, the penguin's down there, you can hardly see him. We've got a bunch of vets and endoscopy experts and one of our rehabilitation staff putting a camera down his throat, and that's watching through the camera at what we found inside his stomach. And this is what we saw. So this is the image that you get through the camera, and that's what we're seeing in the stomach. We blew the stomach up full of air so that you could see what's going on. And this is a grabbing tool. It's just getting closer and closer. Pretty delicate to try and maneuver that at the end of a long camera to try and grab what's inside. But with a lot of effort, we finally got it, and we were able to pull that out. Luckily, the grabbing jaws were big enough to grasp across the engine, the item. And what we found was this. It was a coin, a South African 2 rand coin. Not causing too much damage in there. It caused a few little stomach ulcers, which were quite easy to treat. And what was nice is, this is the first patient to ever pay for its surgical procedure at SANCCOB. None of the others give us anything. And from that 2 rand coin, we were actually able to auction it. And on the auction, it was bought by a collector and raised 2,000 South African rand, so that was excellent. Sometimes we get some other amazing patients. This is a great white pelican. He had a wing wound, and our rehab currently very proud of weighing a pelican. And of course, they're enormous. They can't fit on a normal scale. Usually we pop a bird into this little crate. That goes on the scale. When you've got something this size, you've got to really find a different way. Weigh Kirtley and the pelican, and then subtract Kirtley's weight later. Here's the wound that was in his wing. So his body is actually on the right over here, tip of the wing. So this is around his elbow. Quite a nasty wound there. But with a bit of treatment, some surgical debriding and nice bandage, we started to heal. That slowly got better. It was quite a long process. So bandaged the wing just to keep it immobilized while the healing was happening. And then of course we have to take that bandage off and exercise the wing so that it doesn't seize up. So it's a delicate procedure of not bandaging it too much, but not letting it loose so you can damage that wound again. It's the wound as it was healing, still looking rather raw. So as the healing process was continuing, still needed quite a lot of cleaning, but soon got better. And this is just an example of a patient that stayed with us a while and started off with difficult management, which we tried to make as stress-free for the bird as possible. But of course, when he needs his medicine, this is how you give medicine to a pelican. You get 2 interns, one to hold him, and the other one to get a syringe all the way down the throat. And that's a stinky throat as well. They don't brush their teeth much. And using those big syringes to get some food in. As soon as he's calmed down a bit, we can really reduce the handling, and that's great because for all these wild animals, we don't want to manhandle them too much. That's a very stressful procedure, so we only use it when we really need to. But after a while, he learned to catch fish all on his own. So that was great. There's just somebody throwing fish to him. And it's much less stressful, much happier, and much easier to get his fish to him. And here's also just after his wing had healed properly, the wound's over there, but he was using it really strongly really early on. Pelicans are great survivors, really strong. So once again, just checking that his wings are flapping properly. And here was successful release. So we've got a little nature reserve right next door to Cape Town, next to our Cape Town facility. So we can release the pelicans right there. The other birds, the more sea-based birds, we release at the colonies in the wild. But this is a natural habitat for pelicans, and they do really well here. And then he can join his group of other pelicans on the dam, and when it's safe, when he's fit enough to do so, he can fish there for a while, and then he can go off with the other pelicans as they fly off to sea. But a few other techniques are some of the little birds that we look after. This is Hartlop's gull, one of our smallest seagulls, and we've got a few wing injuries quite often. And if you've got a single or two wing bones broken here, so this is the radius and ulna, the lower wing bones, you can actually just put a splint on the outside. You don't have to do any difficult orthopedic surgery, and that works really well to stabilize it. So the actual injury is here. It hasn't broken the skin, so it's just a broken bone underneath. We pull out some of the feathers and we tie a splint to these secondary feathers over here, and that allows these ones to grow back very quickly. These secondary feathers are actually inserted on the bone of the ulna. So if you put a splint onto it, that stabilizes the whole joint. A little bit of bleeding here from just putting the sutures through the skin. And if it's done properly, you keep a bandage on for a while, and then the splint actually holds it after that. You don't need to bandage it. They can even fly with these splints on as they're healing. So sometimes we get quite a few. So they have 4 gulls at the same time with similar splints. Other orthopedic cases, these are really great when they work. They're always difficult, but you can. This is an African penguin. So there's his backbone, his tail's over here, head's on the left, and so these are his hips. So you've got one leg going off the top, another one coming down here, and that's his femur, the upper leg bone, which is snapped. So there's one piece, another piece there, and then the lower leg bone is going down there. So difficult to get at, but not impossible. So here we have him under anesthetic, bubble wrap. That's just like a blanket to keep him warm. And just here, it's one of the few times when we do shave our patients. Because it's an orthopedic procedure, we really need it as clean and sterile as possible. So shaved and scrubbed, and then ready in our theatre, ready for surgery. After the surgery, so these pins are actually drilled through into the bone. So there's his hip goes down there, that's the knee, and then leg going down there. And these are inside the bone just to stabilize it. There he is standing around with his pins in place, and you can actually already start standing. The weight of the penguin is borne by these pins on the outside. And he keeps those for about 6 weeks until we remove them. And then they're removed. There's one of our home pen birds just running past trying to get part of the photograph. But yeah, standing already, pins removed, and just waiting for his feathers to grow back now. So that was the end of last year, and over December he actually molted, and all the feathers grew back and he could be released. So those are just a few of the amazing patients that you've seen, and I'm just going to take a moment to talk about what we're dealing with at present, which is quite amazing. So we're in the middle of a big rescue operation. At SANCCOB, we have over 1,000 Cape Cormorant chicks. So this is a Cape Cormorant chick, and they are an endangered species as well. Most countries all over the world have cormorants which inhabit the coastal waters, and our Cape Cormorants are not doing very well at the moment. Populations are declining, mainly because of lack of food. Overfishing has caused the collapse of the ocean ecosystem, and accompanied by all sorts of other pressures such as pollution and climate change. And so these guys find it really hard to find food. And just recently, the parents of 2 colonies off the coast of South Africa left the colonies before the chicks had fledged properly, and the chicks would have died in the wild, so they came to SANCCOB. And we've been working very hard to stabilize them, and now they're looking pretty good. Finally, they're not too bad, and so now they need to stay with us until they can grow enough to grow their feathers, learn to fly, and then be released again. So, but it's a lot of hard work. So this is the Cape Cormorant chick, one of the little ones on admission, not looking very healthy, a little bit dehydrated, but not too bad at this time. So just to show the extent of the response, we admitted the chicks over several days. As they came in, we had to first stabilize them. So here's a team of some of our volunteers and interns and staff members, just all lined up in a row, feeding birds late at night. So we got some head torches out, and we were still tubing them, because you can't go home until all the animals are fed. So buckets full of syringes of formula or fluids, and individual birds being held and tubed. So when they're really weak, they don't eat on their own. So each individual has to be picked up a few times a day and given either fluids or something to eat, or what we call formula, which is a fish smoothie, which is easier for them to digest than giving them big fish when they're still weak. There are a few of the individuals, some of the 1,000 birds that we have at the moment, very hungry, very enthusiastic for food. You can see they're all really alert, looking for the next meal. Here's just a few of them eating. So a few of them did learn to free feed quite quickly. You could just put down some chopped fish and they'd help themselves. That was a really great time. We've only had them for just over 2 weeks now, but when you first find out that you can put down food and they'll feed themselves, it's a really great feeling. Then you just have to handle them less, so we just have to give them fluids. If they're small, sometimes some formula, just so that they don't lose weight. But the more and more they eat on their own, the less to do, and it's less interaction and more chance for them to behave normally and be wild. And then, yes, we've just been helped by an amazing team of volunteers from all walks of life. Here's a group of people just coming in and preparing medication. So when you have to deworm 1,000 cormorants, there are a lot of syringes. They're drawing up different amounts of deworming for the different age groups, different weights of cormorants, and then we take those down to the pens and give each of the cormorants got 2 different syringes, and they're just given orally down the throat. There's one of our evening debrief sessions. We worked hours and hours every day. So this is about 8 o'clock at night, having a quick meeting, wrapping up the day, assigning the last few tasks. So this wasn't home time even. This was just quickly checking what needs to be done before going home, and then everyone went back and carried on working. Luckily now we're back to slightly better, more human work hours. But as you can see, it's also in the middle of a COVID outbreak. We have to have all our meetings outside, socially distanced. And you can see all the exhausted people, but they carried on working. And that's that day and the day after that and the day after that. So really great response we've had, and we've got a lot of really well-fed birds at the moment because of it. And that's all for me. So I'd love to hear some questions. So yeah, you can type them into the Q&A box.
Okay, thank you so much, Dr. That was fascinating. We do actually have a lot of questions, like enthusiastic questions for you. So I will go ahead and pull up some of these for you. We'll try to keep as many as possible in the time we have. We appreciate the questions that have been submitted. So let's just go here. Some of these questions are about specific procedures that you mentioned. So for the blood smears that you're looking at, are you looking mostly for viruses or for infections?
Sorry, I didn't quite catch that. Could you repeat the question?
Sure. First of all, if you can share your screen, that would be helpful.
Sorry, it's still a little bit of interference there.
Sorry. Could you stop your screen sharing first?
Oh, yes, of course. So that's easier. Thanks.
Perfect. Yeah, no worries. So one of the first questions that came in was about the blood smears that you're looking at. Are you mostly looking for viruses or what kind of infections?
Okay, so the penguins and other birds often suffer from a few different things. They originally, when they come in, they could be underweight, and therefore emaciated. They could be anemic. So we're looking at just their relative blood counts, if they have anemia or not, and whether or not they're regenerating. And then, of course, if they come in with wounds, we're looking at potential infections of those wounds. So whether or not they're they have a white blood cell response, and that's usually bacterial infections. And then we also look for parasites. So there's some little parasites actually transmitted by ticks, and they live inside the red blood cells, and they can destroy those. So the blood smear is really good for looking at those. Things like babesia, malaria, we can also pick up. So there's a bird malaria that affects penguins quite badly. So we find that on the blood smears. And then as they go through the system, because they're in an unnatural environment, they still have possibility of getting infected while they're in the facility, and they can pick up lung infections, respiratory infections, especially fungal infections. And if they have any of those, they will also show an increased white blood cell response. So we're just looking out for signs of those things, especially the respiratory infections. If we can catch them early, they're a lot easier to treat than if they already have symptoms and they start coughing and sneezing.
Great. Thank you. There was a question about why we use bubble wrap to cover their fins and feet during surgery.
So we experimented with a few things. We realized that, under anesthetic, animals don't maintain their body temperature as well as they would normally. So they lose their homeostatic function. And so they either get too hot or too cold really quickly, depending on the temperature in the room. So we could use blankets as well, but blankets are harder to clean. Bubble wrap we can use, and we can sterilize and spray down with a disinfectant. If it gets really tatty and old, we can throw it away and replace it quite easily. And it's really good insulation. So it's just something we had lying around, and it's worked really well. We've replaced some of the bubble wrap now with socks. And so we have these little baby socks. They're very cute. And those go on the penguin's feet, and some bigger socks that go on the flippers. And those just go through the laundry. But we still use some bubble wrap as little blankets for the penguins if they are getting cold and with surgery.
Okay. Someone had a question about the process of washing the birds. How do the birds react when they're being cleaned from oiling?
Sorry, so you're asking how they react to the oiling?
How they react to being washed.
Okay, yes. They don't enjoy it at all. So because they're usually wild birds, they're usually stressed and they haven't had any human interaction. Even birds and penguins in zoos don't like people picking them up. But so it has to be a very careful procedure. First of all, we need to make sure they're not too sick. Before they get oiled, they need to be strong enough before they get washed. So strong enough to cope with the washing. And then you really need skilled people doing it as well. So somebody who's really skilled at handling penguins, so they can do it firmly enough that the penguins don't panic, but gently enough so that they don't hurt the birds. And then a skilled washer as well to get through the job as quickly and as thoroughly as possible. Because the other thing you don't want to do is wash them all at once. So you really have to get everything off at once. And sometimes with a good handler, the birds do calm down and they actually enjoy the washing motion, because you use warm water, and if you don't panic them too much, they actually sometimes even go to sleep. So right at the beginning, they don't like the handling, but if you're doing it properly, it can be not a terrible experience for the birds.
All right. Some more great questions coming in. How often do you know what kind of situation caused an injury?
Sorry.
The question is, how often are you able to tell what kind of situation caused an injury?
So, so if we've got the oiling events, then yes, we can often track down the cause of the oiling because we've got really good maritime monitoring. Other times we get birds in which they may be injured, and we have got no idea why they were injured. So something comes in with a bite or something, then sometimes we can look at the bite, and it looks like a shark bite because the feathers are cut rather than punctured, as it would be with a seal bite. Sometimes you can see typical wounds with enough experience. But things happen in the wild, and we get the animals in after they've happened. So sometimes you get a weak bird, and you just have to work it out. Sometimes you never really know what happened.
All right. There was someone who asked if you track any of the birds you release. And this person also said that this talk is awesome.
Thank you. Yes, so it's a very important part of any rehabilitation procedure, or any time that anyone looks after animals and then release them back in the wild. The job isn't done until you can tell whether or not the animal actually survived in the wild. So yeah, all rehabilitation really should have post-release monitoring. What we do is we've had some tracking with satellite tracking. That's great fun, but very expensive, and you can see exactly where they go. Most of the time what we do is you put a microchip into the animals. So it's a little microchip under the skin, just as you would do for your pets. And what's really cool is in our colonies, we have microchip readers that look like long hose pipes on the ground. And any bird that walks over it and has a microchip, it will actually record that number. And then we just go up every now and then and replace the memory card in that reader. And we get all the information, all the birds that walked over that reader, and then we can see if they were SANCCOB birds, how long since they were released. We also we look after a lot of chicks, and then we release them, and we try to microchip a large number of animals in the wild, similar to the number of animals that we release from SANCCOB, so we can look at the survival rates in both groups, just to make sure that our birds are doing just as well as those in the wild.
That's fascinating. So we're getting a number of questions about the fish that you're feeding. Some questions about where you're getting the large amount of fish. And one of our friends, Daisy, would like to know whether you have to feed a specific kind of fish to the penguins.
So our penguins naturally eat small pelagic schooling fish. So those are usually anchovies and sardines. And luckily, those are commercially caught and quite readily available. So we buy them just the same way that anyone would buy sardines. We get tons and tons. At the moment, these cormorants are probably going to eat 20 tons of fish before they're released. And so we buy them in bulk, and we keep them some off-site, and then as we need them, we bring them on site and keep them in our freezer and defrost them. But it is a huge operation making sure we get the fish, especially because fish prices are not good at the moment because there's too little fish in the sea. So yeah, we'd much rather the penguins stayed in the wild and ate the fish over there, and we didn't have to catch fish to feed to them.
Great. Our questions are ranging far and wide here. I have a question about the incisions that you do during surgeries. Does that ever compromise the ability of the penguin to stay insulated long term? Or do the feathers that come back generally cover most surgically repaired areas?
Okay, so it's a very important part of what I do as a vet is to make sure that we have as little scar tissue as possible. And so, yes, any areas that have big nasty scars often don't grow feathers back, and they often are the ones that will cause a wet spot in the waterproofing of the birds. So my first job is to try and close those wounds without scars. Sometimes during the surgical procedure we do have to lose a few feathers, or some of the feathers fall out or they may have been damaged, and then we do need to wait until they regrow the feathers, and then we look at them after the surgery is completed, after they've healed properly, and then they go into rehabilitation routine. So every bird that's got through whatever else he came in for still needs to go through rehabilitation, and in that process they actually get tested for waterproofing. So they first have to swim for 20 minutes at a time, and if they waterproof after that, then they get forced to swim for 1 hour at a time, 3 times a day, and then they get tested for waterproofing after that. And for example, if there's been a surgery with a bad scar, and then they won't pass that waterproofing, and that means that I have to go and do a bit of plastic surgery and remove the scar and close it up again until there's perfect waterproofing before we release them.
Wow, that's quite a process. We have a lot of questions here about bones. We have Eddie, who is 6 years old, would like to know how many bones there are in a penguin's body.
That's a great question, and unfortunately not one I know the answer to. I'm going to have to look it up now because I feel inadequate. Penguin bones are very similar to the bones in most vertebrates, so that's animals with bones. And so often even those bones that I was showing everyone that were broken in the penguins are very similar to the same ones that you and I have. So it's not exactly as many as people have, but it would be pretty close.
Great. People were asking as well about the biggest reasons that you're seeing those broken bones. Is this from fighting among the birds? Is it from hitting boats? Do you know what those common causes are?
I'm not sure exactly what causes them. As we say, those wounds that happen in the wild, often we don't know. Many of them are definitely caused by predators. So one of the big predators of penguins is Cape fur seals. And if they attack a penguin and they grab it by the feet, they can break the leg and not actually catch the penguin. The penguin gets away if it has a broken leg. We've seen that a few times. Another problem is also, once again, a lack of good quality food. So if they're not feeding enough, they can have a calcium deficiency, which causes them to have soft bones. And then any little trauma is more likely to cause breaks. So recently we've had a few Cape gannets that had broken bones, and we worried that they didn't have the right nutrition, and that's why suddenly there were lots of breaks around about the same time.
Interesting. Someone has asked what you all do with the animals that cannot be released back into the wild.
Okay. So it's not a pretty story, but unfortunately we can't keep them in captivity. We can't take animals out of the wild to keep in captivity, and therefore those that can't be successfully released have to be put down. And so we do our best to release as many as possible, but anything that wouldn't have a good quality of life gets put to sleep rather than keeping it in a captive environment, and that's to reduce the chances of animals being taken out of the wild illegally and sold to captive institutions.
The question about the cormorants. Since the cormorant chicks have no adults to teach them how to fly, how do you all take care of that?
It's actually amazing just how well all our chicks do without any adults teaching them how to fly. They grow up and they start flapping and they start practicing and they learn how to fly all on their own. Just the same way that the penguins go up and they know that chasing shiny things means that they get a meal. So they get into the sea and they find fish and they go and catch them. And they can swim, and they can swim fast and well without any parents to teach them. What we do is we also release them in a natural colony, so close to where there are adults, and that definitely helps them learn how to interact with other animals of their same species, other birds, and where to find food and things like that. Then they can fly all on their own, but it's much better if you release them near some adults so they can follow the adults, start learning behavior from them too.
That's amazing. There's a question about plastics and plastic pollution. How much is plastic pollution a problem in your area? And to what extent is that a big problem with the patients that you see?
So luckily with penguins, they don't eat plastic. So we're very grateful that we don't often see plastic problems, or at least plastic being eaten by the penguins. It is a very big problem for other seabirds. Things like albatrosses really suffer from plastic pollution. Anything that picks things up from the surface of the water. What we do see is animals entangled in fishing gear. So any fishing line that gets discarded improperly is always a potential trap for any animal. So we often get birds that are tied up in fishing lines, sometimes other string, rope, and nets and things like that. Every now and then we get something that's been caught in a ring or a plastic bottle or something like that. So definitely it's a problem. And it's a problem that maybe at SANCCOB we don't see as much as there really is a problem in the wild. Because anything that dies from plastic pollution or gets tangled up doesn't necessarily come through to rehabilitation. They often die in the wild where there's nobody to help them. So definitely want to encourage everyone to reduce the use of single-use plastics wherever they can.
Absolutely. How has the pandemic affected the wild populations of things like African penguins? And are there fewer people in the areas where these birds are?
Yeah, so we've had some really nice positive responses from the pandemic. It's always good to have some good pandemic good news, because in South Africa we had to close our beaches quite thoroughly for a long time. And so there have been some good news stories that the penguins really enjoying having nobody else on their beach, running around all over the place. We've definitely had some good breeding success with other little shorebirds, things that breed on beaches that often get disturbed by beachgoers. So that's been great. And so, yeah, there's definitely been some plus sides to not having people around disturbing animals. They've done a little bit better on their own. From an organization point of view, just like everyone else, we've had to make drastic changes. But yeah, we've been able to pull through, and just through the support of some amazing organizations and some also just really amazing volunteers who come and help us.
We did have a question about the role of zoos in the work that you do. The Maryland Zoo, we've been very privileged over the years to be able to partner with SANCCOB and to send some staff down to help out with some efforts in South Africa. Could you speak more to the relationship that SANCCOB has with zoos throughout the world?
So zoos are, and aquaria are just some of the major fund donors for SANCCOB. They're our great ambassadors. We've got penguins all over the world that people go to see, and they learn about SANCCOB, or people learn about SANCCOB when they go to see the penguins. And so, yeah, every facility that has African penguins and other amazing animals, for people to go and see in their own hometowns or own countries, it's just amazing to have those ambassadors to show what's happening in the wild. So we're always really grateful to say, yeah, we've been involved with many amazing organizations. And one of the great things is at the end of the year, during December, November, in our summer, we often get zookeepers who spend their whole lives working with penguins to come to SANCCOB and give us a hand when we most need it, when we've got most animals to look after. We really felt that this year when we didn't have international travel and we couldn't get people in from all over the world. We've been really well supported by the South Africans, and we really want to thank them for being our volunteers when we couldn't have zookeepers from all over. But we want to invite everyone back again as soon as they can to come and spend some time with wild penguins in Africa.
Wonderful. Just a reminder, we still have a few questions left. If you have any burning questions remaining, please put that in the Q&A and we will get to as many as we can. So Dr. Roberts, let's see, there's still some coming in. There's some questions about how the patients get to you. Who's actually finding and bringing these animals to the facility?
Okay, so we have a whole lot of really enthusiastic people who assist us. Those often are our first responders. Those are just members of the public. We've had some training in bird handling. They came to SANCCOB and we taught them how to rescue birds and how to keep them and transport them to us. So those are key responders. Those are the people who go and rescue the birds on the beach, and they're usually just normal everyday people who are really enthusiastic. And so we get a call from the public. It's usually somebody who's walking along the beach and sees an animal in distress. They call us up, and one of the first responders goes out and does the rescue, or one of our staff members does. And then we have seabird rangers. So those are people who live and work near the colonies, and usually either on the islands or in the seabird colonies, who work for SANCCOB or in collaboration with SANCCOB and other organizations. And they part of their job is conservation of the birds in the wild, and notifying of us of anything that might need support, anything that needs a little bit of human intervention, and then we arrange transport to get them to us.
Do you ever see return patients or particular species that keep coming back in?
So yeah, occasionally. Sometimes the little chicks that we've rescued and rehabilitated, or something that's had one problem, gone out in the wild, and a few years later we get it back again because it had some other problem. So that's really, yeah, it's not nice to see that they're in trouble again. But usually, if it's been a few years, you know that they've been out in the wild, they're doing well. Yeah, and especially if we can do something for them, then it's great to see those familiar faces. Of course, we don't recognize them until we get the microchip readout and we see, oh, he's been here before, and then we look him up. So we see a few of those every year, and sometimes, occasionally, one of the penguins is too friendly on release or doesn't quite make it on release, and therefore comes back to SANCCOB, and we go through the whole system again. Sometimes they get a bit skinny the first time they go out. Every now and then we get a skinny one in, and then he gets released again when he's slightly older or bigger, or maybe had a little bit of infection. We have to treat that. But yeah, usually we don't see them again except on the microchip readers out in the wild.
We have some more interest in penguin feathers and molting and surgeries. So the question is, do you have cases of molting abnormalities in penguins after a surgery?
Usually not. So one of our worries, and something I'd really like to get some more research done on, is how do we get the penguins to molt just after the surgery when everything's healed, instead of having to wait for till the end of the year or to summer for them to molt naturally. And there are several methods, but we haven't perfected them yet. But yeah, not usually molting abnormalities due to the surgery. We definitely do see molting abnormalities in the wild. Often penguins, if they can't get fat enough before they should molt, then they can't go through the molt process, and so they skip a molt, or they have a delayed molt, or they start molting and then it stops again. And that's usually just because they can't find enough food, they can't get fat enough. And some of those every year come through to SANCCOB, and we just help them through that molt process. And then once they're molted again, they go out. We call them arrested molters if they didn't molt properly. And that seems to be a problem that we see quite often, and it's definitely linked to them not being fat enough before they go into the molt process.
That's amazing. I would not have thought that arrested molters would have been part of your population. That's fascinating. And we have one more question. So are you all finding an increase in international interest in and work on reducing oil spills?
Yes, definitely. I mean, worldwide laws are getting better at reducing oil spills, depending on different countries and their maritime laws. And so the small oil spills that historically were caused by people illegally dumping small amounts of oil or cleaning out their tanks at sea are definitely reduced, especially in South Africa. But there's huge international collaboration to try and reduce the threat of oil spills, and also just being more prepared for when they happen. So SANCCOB's part of the global oiled wildlife response, collaboration of oiled wildlife responders who share information and plan for oil spills and what to do if there is one and how to respond. And then, of course, that's just the wildlife side. Preventing and dealing with oil spills is more than just this wildlife. It's also cleaning up beaches and protecting people and reducing the long-standing effects of the pollution. We're just the part of that big operation. But definitely all over the world, there's a lot of collaboration to make it better. We were just recently at the International Penguin Conference in New Zealand, where they run a really good world wildlife response training program, and there are places all over the world to do the same thing.
All right, well, thank you so much, Dr. Roberts, for taking this time to talk with us. We know this is a particularly challenging time with the Cormorant work, so we're so pleased to have had you speak to us today. Thank you. We have put in the chat box a link for folks who would like to make a donation to support SANCCOB's work. We hope you all will consider doing that. We'd like to thank again our sponsor, SANCCOB Group, for helping us bring these virtual field talks to a wide audience. And we thank all of you for joining us today. We hope that you will join us for another field talk. Thank you again to Dr. Roberts. That was a really fascinating presentation.
Thanks for having me. Goodbye and take care.
Thank you so much. Take care.